My name is Steve Halter, and this is my ethnography for Leadership and Ethics with Dr. Grant, the cultural and ethic critique in a private medical practice. To give you a little bit of background, I currently work for a private medical practice here in the city that's never really utilized any type of meeting agenda or meeting in general to enhance the overall functionality and issues that may occur in the medical office. Um, Conflict was definitely occurring between the office manager and clinical director because there really was no specific role description within the organization that would hold any person accountable for specific tasks, um, creating a issue between the two departments, um, and they were really not willing to work together in uh, delivering a solution that would create a teamwork environment. Um, and it ultimately caused in a lot of dysfunction and a lot of missed opportunity in performance within the practice, and it needed to be resolved quite quickly. After being in position for a couple of months and having ongoing conversations with the doctor, we did decide on implementing a meeting structure that would be bi-weekly, every other Monday morning, starting at 7 a.m. and ending at 8 a.m. before the patients were to begin to arrive. Um, the meetings consisted of the doctor herself, a physician assistant, the clinical director with the office manager, and then myself were the ones in the room. To give you a little idea of the meeting place, it's a dual function room, so it serves as not only the lunchroom, but it does serve as the conference room where these meetings take place. It is kind of a, I guess, homey farmhouse dining room environment, so to speak. It houses a large farm table that can sit 8 very comfortably. And then it has a matching buffet that sits off to the side where, there's cookie tins that have been delivered to the office over past holidays for decoration. Um, creating a little bit more of a homey feel, I guess. There's also a large overstuffed plaid sofa that is in position that adds not only additional seating, but can also give somebody a 15-minute break on relaxation if so needed during the workday. Um, the meetings, like I said, begin at 7 a.m., and it's pretty consistent that the doctor runs about 5 to 10 minutes late for each meeting, causing a little bit of delay in the start time. However, the meetings really have no specific agenda. However, when the doctor does arrive, she begins to recap last month's performance and the improvements that we need to make in internally. So her recap would consist of billing, accounts receivable, patient balances, insurance balances, looking at collection rates, and then the progress over the last 2 weeks and where we continue to stand on that stuff. She also addresses patient wait times, patient cancellations due to wait times, time spent with patients in exam rooms, stuff to just give us a little bit more insight as to how we're managing our time. And then lastly, she likes to review any social media feedback, reviews, and be able to celebrate the successes that we've had from those. Also acknowledge the opportunities that we have based on patient feedback and what we can do internally, I guess, in creating a different environment where it's not a continual negative review on social media. So the meetings consist usually of the doctor, the physician assistant, the clinical director. We have an office manager, and then myself in administration as well. Um, we usually sit there, like I said, it's an open format, never really a true agenda, but the agendas continually revolve around roles and responsibility. It revolves around poor communication, not only between the clinical and the office staff, but also from the providers on down and the office staff on up. And just overall opportunities that we have addressing any situations that may have arisen in the previous 2 weeks, and really looking at solutions that can be created that allow for a more improved function within the office. Um, the said meetings have really taken a turn for the better after many of our meetings that consist of closed body language and really looking at frustration and um, instability, I guess, amongst everybody and their position. The doctor has really turned into focusing on more of a deontological ethics approach, where she's really looking at her duty as a leader and her responsibility as making these internal changes that can help shape the organization into providing a more consistent and cohesive environment, and really looking at the specifics and how she can create accountability amongst her own leaders and allowing these changes to take place. Um, she really looks at, from one said meeting, she really looked at an immediate change in the reporting structure. Um, she now has the reporting structure set as the clinical director and medical assistants now report to the physician assistant, where the office manager and myself now report to her directly, which gives us a little bit more cohesiveness, and then it also allows a smaller environment to make suggestions and create solutions that we can kind of work together as a team and understand that both sides are not always going to be right, but we're going to have to create a happy medium in order for the organization to continue to enhance its performance. She's very focused on the meetings now ending in a positive manner. She really looks at her leaders as solution drivers, and really what her duty is to create a function where everyone feels comfortable coming to work. We have a good time, and it's creating her to shape her organization from this point forward, where she is allowing for advice and suggestions from others to create a more, I guess, user-friendly environment from those who are within the four walls. And I think this has been proven successful these last 4 weeks since she's made this change. And it really goes to show that when you focus on ethics and what you need from your leadership team as a leader, you can begin to deliver different results and create an environment that will be successful.